a payer accountability and revenue intelligence layer across the entire revenue transaction. Alexander AIRIM. Prevent, prove, recover, control. The Beyond Health Master Loader provides one intake layer for the financial and clinical information needed to understand the complete revenue transaction. 837 claims, 835 remittances, X12 transactions, clinical documentation, payer policies, contracts, and supporting healthcare data. The objective is simple. Load the information once, connect it, and make it usable across the Revenue Intelligence Management platform. Now we move from loading the information to understanding what happened to the revenue. This is Alexander RIM Payer Accountability, a payer accountability and revenue intelligence layer across the entire revenue transaction. Prevent, prove, recover, control. The executive view brings 5 different forms of revenue intelligence together. The payer contradiction detector has identified 64 signals. The systemic evidence engine has assembled more than 1,400 evidence relationships. Contract and Payment Truth has identified more than 4,000 positive payment variances in this controlled validation dataset. Clean Claim Readiness identifies documentation gaps before they become downstream revenue problems. And the Payer Decision Simulator is operating across 20,000 controlled risk records. The important point isn't any single number. It is that these are no longer 5 disconnected problems. Alexander connects them through the same revenue intelligence layer. Payer contradictions. Traditional RCM often starts after something has already gone wrong. Alexander asks a different question. Does what the payer is doing now agree with what the payer previously said? Authorized, accepted, adjudicated, or paid? Here the system identifies transaction-level contradictions and variance signals and preserves the underlying claim and payer relationships. Instead of simply saying, "This claim was denied," RIM begins asking, does the payer's complete transaction history support that decision? Systemic Evidence Engine. Finding a contradiction is only the beginning. The Systemic Evidence Engine connects the supporting evidence, claim events, payer transactions, timelines, supporting records, and accountability scoring. The goal is to move from an isolated denial or underpayment to a defensible evidence package. And when similar behavior repeats across claims, those individual events can begin revealing something much more important: a systemic payer pattern. That changes the conversation for revenue cycle, HIM, finance, managed care, compliance, and potentially counsel. Next is Contract and Payment Truth. This layer asks one of the most basic questions in healthcare finance. What should we have been paid? And what were we actually paid? Alexander connects expected reimbursement, actual adjudication, and resulting variance. At scale, this becomes more than another underpayment report. It becomes a way to measure payer performance against the financial truth of the underlying transaction. The contract says one thing. The payment says another. RIM finds the difference. Clean Claim Readiness. But RIM should not only recover revenue after the damage occurs. It should prevent avoidable loss. Clean Claim Readiness looks for documentation and evidentiary gaps before the claim progresses further through the revenue cycle. The objective is not simply, will the claim pass an edit? The more important question is, can the provider prove this claim if the payer challenges it? That moves revenue intelligence upstream, from reactive denial management to prevention. Finally, Alexander begins learning from historical payer behavior. The Payer Decision Simulator examines payer history and develops risk intelligence across the controlled claim population. Historical behavior can be compared by payer, provider, procedure, and other financial characteristics. The predictive layer then identifies transactions requiring greater attention or monitoring. At this stage, we call this a decision simulator, not a promise that Alexander knows exactly what a payer will do. The purpose is to use observable payer behavior to help determine where is the next revenue risk likely to appear. This is the larger idea behind Alexander RIM. Healthcare does not need 5 more disconnected dashboards. It needs the ability to connect what the provider did, what the provider can prove, what the payer said, what the contract required, what was submitted, what was adjudicated, and what was actually paid. Then determine whether the entire revenue transaction agrees. Payer accountability, revenue intelligence, provider controlled, prevent, prove, recover, control. This is Alexander AIRIM.